Hello, I'm Dr. Mike Hollern, Hollern Chiropractic in Louisville, Kentucky. I wanted to take a moment and talk about kids in chiropractic because sometimes people, they look at you a little weird when you tell them that there's some things that children will respond to when they get adjusted. One of the things is, this happened for very first year in practice. A patient brought me a little boy. She said, Dr. Hollern, he's not breathing right. It sounds like he's wheezing all the time. So what I did is I palpated his spine, and in AJ's case, I adjusted the very first vertebrae and also the upper back area where I found misalignments. And she called me that night. She said, Dr. Hollern, what'd you do to AJ? Well, I said, what are you talking about? She said, he's breathing normal. So kids respond to chiropractic very well. A couple of other things that I noticed with children over the years is that ear infections, a lot of times if you adjust the very first vertebrae, because the nerve that goes to the muscle that causes the tympanic membrane to open and close, it gets stuck, and the tympanic membrane does not open and close, and water builds up behind the membrane. That's when kids get ear infections. And if you adjust that specific area of the spine, allows that muscle to relax, the ear drains, and then they don't have to have tubes in their ears. One other one I see is a lot of times with babies, and we just had a baby in here today. I think she was 6 months old, but I've adjusted babies even younger than that, is that he hadn't gone to the bathroom in 3 or 4 days. So what I did is I adjusted the upper low back area, and it clears out, and all of a sudden the baby is able to go to the bathroom a little bit easier. But kids have the same spine that you and I have, that your parents have, that you have. It's a matter of just being real gentle, finding out where the misalignment is, adjusting it, and then watching the children respond very nicely. I'm Dr. Mike Hollern, Hollern Chiropractic, 502-366-9200. If you have any children that are having issues, bring them in. Let's check them out.